Hi, I'm Peter Glowicki from Mayo Clinic, Editor-in-Chief of the Journal of Vascular Surgery. As we go to the press today on Halloween Day, almost 46 million people in the world are infected with the COVID virus and almost 1.2 million died. In the United States, over 9.1 million people have tested positive so far and over 230,000 died. The COVID-19 collection of the JVS journals continues to grow, and it includes now more than 70 publications on COVID-19 and vascular disease. Today I am pleased to introduce to you the 2021 January issue of the JVS and highlight 4 excellent papers which are freely available for viewing for the next 2 months. The editor's choice article for this issue is titled "Evaluating the Prevalence of Abdominal Aortic Aneurysm in the United States Through a National Screening Database." It was written by Dr. Kelly Summers and her colleagues at LSU in New Orleans, Louisiana. In this retrospective review of a National Abdominal Aortic Aneurysm Screening Database, 267 of 9,457 patients, that means 2.82%, were found to have an abdominal aortic aneurysm. The risk factors for an abdominal aortic aneurysm included male gender, smoking, cardiac disease, family history of aneurysms, and advancing age. These findings supported recent recommendations of the Society for Vascular Surgery for aneurysm screening, namely that men and women ages 65 years or older with a smoking history should be screened, and first-degree relative of aneurysm patients who are 65 years or older should also be screened. The data also highlighted the deficiencies of the U.S. Preventative Service Task Force recommendations for aneurysm screening that now includes only men ages 65 to 75 years with or now without smoking history. Groups at high risk for development of aneurysm that are currently outside the USPSTF recommendations included female ever smokers ages 65 to 75 years, male ever smokers younger than 65 years, and males and females who are in good health but who are older than 75 years of age. And the authors concluded that current USPSTF recommendations for screening abdominal aortic aneurysm should be revised. Our next highlighted article is also our CME article for this issue. It's titled "The Benefit of Deferred Carotid Revascularization in Patients with Moderate Severe Disabling Cerebral Ischemic Stroke." The paper was written by Dr. Rodolfo Pini and colleagues from Bologna, Italy, and Poitiers, France. In this multi-center study, 126 patients underwent carotid endarterectomy after moderate to severe stroke. The operations were performed either within 4 weeks or after 4 weeks after the stroke. A perioperative stroke death rate was significantly higher in the group operated within 4 weeks after the stroke, 11.9%, than in the group that was operated after 4 weeks. In that group, it was only 1.7%. And the 1-year stroke rate was also significantly higher in the group operated within 4 weeks. It was 13.9% versus the 1.7% in those operated after 4 weeks. So the author concluded that in patients with moderate to severe stroke due to carotid artery disease, endarterectomy should be performed at least 4 weeks after the stroke. The third article I would like to introduce is entitled "Meaningful Change in 6-Minute Walk in People with Peripheral Artery Disease." This multi-center study, written by Dr. Mary McDermott and colleagues, tried to determine what constitutes meaningful change in a 6-minute walking test that is commonly used, of course, as outcome measure in clinical trials of peripheral arterial disease. 777 patients participated in this observational study. Meaningful change was defined as a noticeable and important walk distance for the patient. A walking impairment questionnaire was filled out by the patient at baseline and 1 year later. Even if no change in walking difficulty was reported, the 6-minute walking distance decreased by 7.2 meters. This was an interesting finding. 1 point improvement by the patient meant a small improvement, and it was 7.8 meters in the 6-minute walk distance, while really a meaningful 2-point large improvement was 20.1 meter in the 6-minute walk distance. So these findings should be considered in future trial of peripheral arterial disease. A final article I would like to introduce today was written by Dr. Ponukamati and colleagues at the Dartmouth-Hitchcock Medical Center in Lebanon and the University of California in Santa Cruz. It is entitled Outcomes of Rotational Atherectomy in Complex Lesions of the Superficial Femoral Artery. In this retrospective cohort study, 53 patients with superficial femoral artery occlusion underwent endovascular treatment. 65% of the patients had chronic limb-threatening ischemia, and 58% had extensive disease, task C or D lesions. All 53 patients were treated with rotational atherectomy, and 46 of them underwent drug-coated balloon angioplasty, and 7 had plain balloon angioplasty. The primary patency in the entire group was 75% at 1 year and 65% at 2 years. Major amputation in the CLTI patients was low. It was 3.9% only at 2 years, and mortality was 10% at 2 years, but no statistical difference was noted between those who were treated with drug-coated balloon versus those who had plain balloon angioplasty. These were just 4 of the many excellent papers we published in the 2021 January issue of the JVS. We hope you'll enjoy reading all of them. Please follow us on social media, and remember, in this time of pandemic, protect your patients, yourself, your family and friends from the COVID-19 virus. Thank you for watching, and see you next time for the highlights of the February issue of the Journal of Vascular Surgery.